And we are live on a Monday on 20 in or on in 2023. Good morning and welcome to it, man. Thank you so much for making time. Thank you so much for joining us. Welcome to it, the first of the many episodes to come for 2023. We are kicking it off with two of our faves, and the other one is having technical difficulties. Okay, I hope she'll be back. Her name is Mapaseka Mabena from Mpho in Eguruleni, and I know that she's still settling because she has moved home, but we'll touch base on that during the conversation to tell us where she is and all that. And also joining us from Mpho in eThekwini, it is Mpho Mankayi, looking dapper for your Monday. Mpho, good morning to you. Thank you so much for your time. Welcome.
Hi everyone, morning. I'm Mpho Mankayi.
How are you?
Thank you so much. Thank you so much for having me on a new year. So I'm very
yeah. I don't know if it's appropriate to still say Happy New Year or compliments of the season because today is the 16th of Jan, but nonetheless, we'll say it to everybody, especially for our new viewers, actually to even our old viewers. Compliments of the year, guys. Thank you so much for choosing us. Thank you so much for streaming this. On a Monday, just went a little bit like 19 minutes away from 11 o'clock, and for the next 30 minutes or so, we'll be dissecting frequently asked questions where we ask our clinicians questions related to PrEP, e.g. PrEP and STI. And like I said, Mpho is here as Mapaseka is here. For questions and comments, use the comment section below. If you are on YouTube, it is @OramPopIn. On Facebook, it is @OramPopIn. And on Twitter, it is @N_health. So with the hashtag Clinical Monday, you can take myself, it is @Nkosi, and we'll be reading your comments and your questions as we go along. If you've missed on the episode or you've missed out on the episode because you've joined a little bit later on, make sure that you rather catch up on these episodes because they will be up on our Facebook page and also on our website, which is www.popin.org. Okay. Now to the business of the day. Sister Basi, are you settled? Are you okay? You went off there a bit. There's a delay. Okay. Try to fix yourself, Sister Basi. We are here for 30 minutes, so we hope by then your network will be fine. But Mpho, let's jump straight into it. I have not segregated segregated the questions on who's going to answer who, but we just go with one.
Yeah, we're having network problems due to the site construction and
no, I know. You moving house, Sister Basi. So as we direct the question to you, if you can hear it, just take it, and we'll see how best we can, sort this issue out as we go. But like I said, 30 minutes is a long time, so I hope you'll be part of the conversation, well, most part of the conversation. But nonetheless, Mpho is here to help us with some of these questions. Mpho, frequently asked questions, people are still asking, even in 2023, what is PrEP? I think we do know what is PrEP, but just remind us. In layman, there is no really another definition. But in layman's term, what is PrEP?
Okay. I think it's questions we always want to tackle a lot. Let's stop saying where people are still asking. Yes, some people don't know about it, and we need to educate. That's why we are here. This is what this platform is all about. So when you're talking about PrEP, we're talking about a pre-exposure prophylaxis. This is a tablet that we give to all the clients that are living with HIV. So you go for a test in your local clinic or pop-in clinic, you test negative, we initiate you PrEP, which is a pre-exposure prophylaxis. It's an antiretroviral, meaning it's part of the HIV drugs, but with this one, it prevents you from being infected with HIV. So it only consists of 2 drugs, which is your tenofovir as well as your emtricitabine. So that's what basically PrEP is.
So we need to emphasize that it is HIV prevention. So it's part of the HIV prevention strategies that we are using, for people that are HIV negative. So I think that needs to be stressed a lot. That is part of it. So you're saying it is, so I want to say, are we then correct to say it's an ARV? Well, not really an ARV, but part of the ARVs.
Yes, it's an antiretroviral. So it is an ARV. So it's an ARV, but this one, it prevents you from being infected with HIV, which is why it's called exposure.
Okay, pre-exposure. There's post-exposure. Maybe perhaps define the two for us.
Okay.
Pre-exposure, PrEP, post-exposure, which is what?
Okay, so like I said, when you talk about pre-exposure, we're talking about PrEP. When you talk about post-exposure, we're talking about it's normally known as PEP. So it's the tablet that you take after being exposed, but it has to be between the 72 hours after the exposure. So with this one, you take it for 28 days to prevent you being infected with HIV. But with PrEP, it's a lifetime long pill, so long that you are willing to be protected from HIV. So with it, you are you have choices of to say if you want to stop with it, even though we don't encourage that to clients, you can stop. But with PEP, you need to take it for the 28 days straight without stopping, because this one it prevents you after the exposure has occurred. So it's taken 8 hours. It has to be taken between 72 hours after the exposure has occurred.
Let's talk about exposure. Somebody might not know what you mean when you say exposure. Take us through what would be some of those, can I say, not experiences, what ways that one could be exposed? Or first, when we say exposure, what do we mean? And take us through different types of exposures that we have to HIV.
Okay, so when you talk about exposure, we're talking about, let's say instead you had an unprotected sexual intercourse where there was penetration and there was exchange of fluids. So that's the exposure number one. The second one, let's say you were sharing needles with someone that's exposed, or you accidentally injected yourself with that needle or razor. That's the second exposure. Or maybe touching of fluids that may contain HIV, like your blood, because it does, like your semen. So that's the kind of exposure that we're talking about.
In terms of, I want to speak about, I don't know if quantity is the right term to use, but you talking Mpho, sorry about that network again. We're experiencing load shedding, so please bear with us in that regard. We just got disconnected there. But I was talking about, you were touching on fluids that potentially would have HIV, but I wanted us to quantify it and to speak about in how many liters. Because, for instance, you can touch saliva from somebody who's HIV positive, but I don't think that you would then have HIV. So perhaps maybe take us through those kind of maybe fluids that would be high in density when it comes to HIV, and some that would not necessarily be harmful if you were to touch them.
Okay. In terms of the saliva part, the research has indicated that it does contain HIV, but it's in small doses. So normally we don't like to touch on the saliva part. But when you're talking about bloods or your semen, for someone that's living with HIV and also someone that's not on their medication, and they have a very high viral load, those are the potential risk of people that would transmit the HIV virus to the other people. But just to be safe, we can never say that there's quantities and you need to know if a person is detected or not. Always you have to always be protected against that. There's no amount to say this is such amount that one needs to have in order for them to pass there. But we know that if the virus is high, then in that way they can always pass the virus to the other person. So which is why we always encourage the PrEP intake, that you must always be on your PrEP to prevent such incidents. If you're not on PrEP, then you go for your PEP, which is the one that's going to protect you after that exposure that we've earlier on highlighted or tapped on.
So exposure is when you have either shared a needle, razor, or you've been exposed to fluids that contain HIV. Also, it's sexually, so we understand what exposure is. I think now everybody is sort of like got up to speed, because these terms sometimes we might take for granted that people know Gandhi to that exposure. Let's talk about how long does it then start working. For instance, you touch on, so it's on both actually post-exposure and pre-exposure. So for PrEP to start working in the system, how long does it take? And for PEP, this is post-exposure, to work in the system, how long does it take? You've counted a 28-day period. for PrEP rather, why is that? And why would it then be different from
All right. I think I got your question, but your network is a bit bad, but okay. So when you talk about PrEP, so for according to South African guides, the guides that guides us, the guides that we use to give PrEP to clients, it indicates that one needs to make sure that for the first 7 days, if you've started with your PrEP, you need to make sure that you use your other alternatives just to make sure that you're protected from HIV, because it's assumed that at that time it's not yet inside your system. So meaning for the first 7 days that we've given you PrEP, you need to make sure that you use your condoms, for instance, just to be protected. So I would say that it takes about 7 days for this the pill to be inside the system. That's for PrEP. However, because we are innovators, we've started with your ED PrEP. With ED PrEP, it becomes different now, because with ED PrEP, the first 2 to 24 hours already it's in your system, because you've taken your 2 tablets, which is now it has higher dose of the one that's you take one, which is your daily tablet. So that's the difference between the two. With other one, it takes 7 days for it to actually be activated into the system or to reach the high blood plasma levels, and then for this one, 2 to 24 hours, it's within the system. But now for PEP, all I know is for the make sure that within 72 hours you've gotten access of it and you continue taking it, which is for the next 28 days.
I think we're losing Sister Mapaseka again. I wanted to pose the question to her that somebody's asking if they can take PrEP while they have an STI. This person possibly has been infected with it. Okay, she's gone. This person has been infected with an STI. Now, can they take an STI? Or rather, not STI, can they take PrEP? And I think there is a question that speaks about STI medication and PrEP, if there is sort of like, I want to say, drug interaction in that regard, but we'll get to that. But Mpho, can someone who has an STI take PrEP, or somebody who's on STI take ED PrEP?
Okay. First of all, these are two things. When you're talking about your PrEP, it's for antiretroviral protection of you being infected with HIV. When you're talking about STI now, it's a different condition. And also, if there's a lot of types of STI, it's not one to say, which is the most common one, your MUS, your male urethritis syndrome. But there's a lot of STIs. So why shouldn't it be that when you are on PrEP, you mustn't take your STI medication? So you continue taking your PrEP. There's no drug-to-drug interactions when it comes to such medication. When you are being infected with an STI or any sort of STI, being it's your genital syndrome, genital ulcer, your male urethritis syndrome, or any other type of an STI, you still continue taking your PrEP. It doesn't have any interactions. It will be effective.
Got you. So then you just have to continue taking your STI medication. So while while infected with an STI, you can still continue taking your PrEP. Now, if I sleep with someone who has an STI and I am on the ED PrEP, can I get sick?
Okay, sick from what? Can you be infected? Can you be infected?
Infected. Well, I think that sick is infected with an STI. So this individual has an STI. This other individual sleeps with this individual who has an STI, but they are on ED PrEP. Can they get sick, or rather, can they get infected with that STI?
Okay. Remember now, when we give you PrEP, like I've indicated earlier on, when you're talking about PrEP, we're talking about an antiretroviral, which is it only protects you from being infected with HIV, but it doesn't tap onto other spaces to say now it prevents you from being infected from an STI. So definitely you are going to get infected with STI. That's if the other person, they not yet gotten medication. For example, let's do your MUS, which is your male urethritis syndrome. It's a most common STI in males, but not in males who sleep with other men, but in males in general. So with that one, when you go to consult with your clinician, after being treated for that, we tell you, which is we call it a contact treatment, or we issue contact slip that you need to give your partner, that they need to come as well and get treated for the same treatment, STI that you have. But for them, it's a prophylaxis, meaning it's you don't have it as yet, but also we prevent you from getting, even if that you may be having it, but we speeding up the process of you guys healing together. So we tell you in that period that when you come and you test, you have an STI, you need to bring your partner as well. They need to be treated. We call it dual treatment. In that case, you might happen that you cannot be infected with an STI, given if your partner was treated for that STI. But if your partner was not treated for an STI, obviously they're gonna pass the infection to you, and you obviously suffer from that. That's I think the sick part that they're talking about. But in terms of HIV, obviously the other person, the one that's on ED-PrEP, for them to be on ED-PrEP, it means that they are living with, they don't have any HIV virus within them, so they can't pass something that they don't have inside of them.
Most definitely. I got you. I think the separation then the clarity needs to be on PrEP protecting us from HIV, or rather from potentially getting HIV, not necessarily from STIs. Not even necessarily. It does not protect us from getting an STI. If you sleep with someone, or rather if you engage in unprotected sexual intercourse with someone with an STI, chances are you might get it. But if they are on medication, then that becomes a bit rather potentially the potential that becomes a bit low. If you just joined us, welcome to it. I have Mpho Mankayi from Mankayi. Oh no, from Durban. Why am I saying Mankayi? I have Mpho Mankayi. This is the Mapaseka from Eguruleni who's struggling with network. Eguruleni has moved house. It's no longer at Tembisa Clinic. It's in Kempton Park. We'll provide you with the details of where the clinic is currently. That's where you can pop in for more treats and visit them on their premises. But for more of that, go to our social media platforms. It is at @in_health when you are on Twitter, and on Facebook it is @PopIn, and www.popin.org gives you the behind the scenes of where they're situated. You can visit them from 8 until 4 in the afternoon and get yourself some treats. And if you have any question from Paul with regards to PrEP, any questions, we are doing frequently asked questions or common questions when it comes to PrEP, ED-PrEP, and STIs. Make sure that you drop it on the comment section below. Happy Phaleng says, nice one, Mpho, gives you a thumbs up and a so I'm only seeing that comment. I'm scared to move things around because my network is terrible to check other platforms, but while the conversation rolls, I'll bring in your comments, so make sure that you share them with us this morning. Now, Mpho, does ED-PrEP work if I am taking antidepressants? I guess this person is on some depression. They've seen Onika if they're in Tshwane. They've seen Vanessa if they're in Eguruleni. Now they've been prescribed antidepressants, and now they rather starting their journey with ED-PrEP. Is there drug interaction? Does it work if they are on ED-PrEP? Or rather, on antidepressants? Maybe it does not work. Take us through that.
Alrighty. I like the fact that you're highlighting on your drug interactions, and there's no drug-to-drug interactions when it comes to PrEP or your antidepressant or your mental health medication. So if you're on ED-PrEP, you can continue taking your ED-PrEP. There's no drug-to-drug interactions. When you're talking about drug-to-drug interactions, we're talking about whereby the other drug now's potency or value being ineffective because of the other medication being in your system, meaning one of the other will suffer because there's a presence of another medication. So there's no drug interactions between the two. So you can take your antidepressants and be on your ED-PrEP as well. There's no drug-to-drug interactions.
Quite interesting though, because I thought then, when you speak about antidepressants, you are really talking about a different, say, field, of treatment, as where I think they are worlds apart, because this is sexually and it has to do with mental health. So there isn't any drug interaction there. And then somebody asked, does PrEP affect hormonal therapy? So I'm guessing this is, I think, I don't want to assume and say transgender women, but these are people, who are on hormonal therapy, and they're asking if I'm on, does it affect my hormonal therapy journey? Go ahead.
Okay. Fortunately not. If you are on daily PrEP, and you are on your hormonal therapy, there's no interactions, drug-to-drug interactions, and there's nothing that's going to happen in terms of PrEP being ineffective in your system. So it continues working. That's if you are a transgender woman and you are on daily PrEP. But now, if you are a transgender woman and you are on ED PrEP, unfortunately, you can't take the two at the same time. You have to be on your daily PrEP, not ED PrEP, because according to the research was only done to transgender women who are not on hormonal therapy. Therefore, we're not sure as yet to say that if you are on ED PrEP, you are really protected from being infected from HIV if you are taking your ED PrEP as well as your hormonal therapy. But if you as well as if you're on hormonal therapy, but if you are taking your daily PrEP and you are on your hormonal therapy, there's no drug-to-drug interactions. Everything would be protected from
so
being
I'm
infected.
assuming, well, things simple. I'm sort of an assumption. It is that when you are a transgender woman on hormonal therapy, you cannot do ED PrEP. But rather you can do daily PrEP. Okay, another question says, must I test every time? Let's underline every time. It says, must I test every time to take ED PrEP or daily PrEP? So must I test every time if I want to take ED PrEP or daily PrEP?
Okay. The criteria, like I've mentioned earlier on, that for one to qualify for ED PrEP or daily PrEP, they have to produce negative results, negative HIV results. Therefore, most definitely, you have to test every time you come at the facility. However, that the guides that we currently using your for your PrEP guides that we use in South Africa, they indicate that in your first month, we give you for a month, you go home. And then when you come back the next time after a month now, we give you for 3 months, meaning it's a prescription for 3 months. Then each and every time you come, you only come to collect. That is also allowed that you come to collect. But if you're gonna meet up with a clinician and when you come back to collect your medication, you sometimes are required to test for HIV because it's only applicable or it's only given to clients who produce negative HIV results.
I got you. So we're trying to check if you are still negative during the process of you taking PrEP. So why is PrEP then? I think I said there is a question that speaks to PrEP part of PEP, and I think you've touched on that. But this question says, why is PrEP part of PEP pills? So does it depend as well? If now I want, if I need PEP, then you couple it with PrEP, or I'm given ARVs. Take me through that process because I think it depends. But go ahead.
Okay, interesting question, I must say. So when you're talking about PEP, like I said earlier on, we're talking about your post-exposure prophylaxis. When you're talking about PrEP, you're talking about your pre-exposure prophylaxis. Now, here's the trick. When it comes to PrEP, it has two components, or rather two ingredients, which is your tenofovir as well as your emtricitabine. When you're talking about PEP, so the pills that we give to clients for PEP, your post-exposure prophylaxis, we're talking about 3 drugs. We're talking about your emtricitabine or lamivudine or tenofovir, as well as your dolutegravir or efavirenz. Let's not include efavirenz. Let's only include dolutegravir. Now, with your PEP, it contains 3 drugs, but 2 drugs are the standard drugs. Two drugs out of the PEP are the standard drugs that are being used on your PrEP tablet. So I think that's where the part of it comes in, but it's not one and the same tablet. It's not the same tablet. So therefore, that's why when we are on PEP, you are given that as a fixed dose combination where there's going to be dolutegravir. But when you're given PrEP, there's no third medication, so it's not part of, but one of the 2 of the ingredients that make up PrEP are also there in your PEP medication.
Okay, I get it. I get it. All right. Now this question says, what is then what is in the injection when treating STI? So I think you guys give us injections when we come and be like, my urine is burning, or I have whatever on my private parts, and there are symptoms that are presenting to you of an STI. Then what is in the injection rather that is used to treat an STI?
All right. Okay. So with the injection, okay. my assumptions that for one to be given an injection will be suffering from MUS, which is male urethritis syndrome. That's the only one that's an indication that we can give clients an injection. That injection is called ceftriaxone. Not every STI that you come to consult an injection. It's only when you have MUS that's when you're gonna get your injection. If you come for your genital herpes, it doesn't require any injection because it's not an bacteria. It's an antiviral, so you can't treat a virus. You can't treat a virus with an antibiotic. That one is not gonna work. It's only clients that are having male urethritis syndrome that are given an injection, which is called ceftriaxone. That's the injection that you get. But if you come with your other genital herpes, your genital warts, or any other type of STI, you're not given an injection for that. So also, even with that one, there's no interactions between the two drugs of your PrEP as well as your ceftriaxone. Sorry, ceftriaxone. That's the name of the medication or the injection.
I got you. Now, antibiotics sometimes are being taken by an injection, right?
Yes, which is ceftriaxone.
Oh, can I just get an injection in GA, even if I'm not sick with an STI, for antibiotics purposes?
Yes, if you come and consult. Yes, if you come and consult any other medication, it comes with your oral dose as well as your injection. Most of the medication, they come in that dose. So if you can't get your Lukunja, okay. So here's the thing with injections. They are more faster in terms of being absorbed by the system, which is why they work faster or quicker inside your system as compared to your medication, with your pills, that is. So each and every medication when it comes in two forms. Not every, but most of the medications, they come in two forms.
Yeah.
Oral, which is your tablet, and then IM, which is intramuscular, which is when we're going to inject you with an injection. It goes with your
But why must you guys? Yeah.
So it goes with your antibiotic. It goes with your yeah.
But Mpho, why do you then have to inject us in the butt area?
Okay, because
why not? Why not? I don't know. Why not here? I don't know. Why not on the thigh? Why must it be specifically be there?
Okay.
Unless if
when you study, you're in a process of getting whatever qualification that's related, health related, you get to learn that when you have certain meals of medication or amount of medication that you need to give to a client. If it's beyond a certain meals, you can't give it elsewhere, but it has to be in the butt. If it's here, it should be within certain meals. But with an STI, it's ceftriaxone. It's more absorbed when it's on the thigh. Because now I'm gonna add other stuff. With children, when you give it to children, we give it on the thigh. We inject it on the thigh. But with adults, we give it on the buttocks because it's quickly absorbed there. Also, it's a very burning medication. It's a very burning injection. I don't think that this part of your arms are very capable of of taking such pain.
Yeah.
So yeah.
No, I mean, I thought it would help all the time. All the time, James, with the buttocks. All the time, the buttocks are like, interesting.
Yeah, that's just how it is. That's just how it is. Yeah, that's just how it is. Like certain meals, you're not supposed to give them elsewhere, but in the buttocks. But if it's below certain meals, you have to give it. Most of your vaccination, when you go to vaccinate for any other can be COVID, can be measles, can be polio, you get it here because it's below certain meals and it's allowed to be go on your arm.
Now it makes sense. Just to share a story, I was in the US, I think about long time ago. Then we were getting shots for a flu shot because there was a flu going around in the US.
Yes.
Then this guy who was part of us that went there said, "But why can't I drink the medication? So don't inject," because he was afraid of needles. He's like put it in the mouth and let me drink it. They're like, no, it has to go here. Now I understand it. No, it's because of certain meals. Obviously, you cannot digest that medication. That's why it comes in an injectable form.
Also, let's clarify that also. So this medication is absorbed differently inside the system. And also there's different parts where medication is being absorbed in your system. So now if it's meant to be IM, which is intramuscular, this is when you get an injection. It gets absorbed here in your muscles. It's not supposed to be absorbed by the mouth. Imagine taking a pill and putting it here. It's not going to get absorbed because it's not supposed to be absorbed. It needs to go through your mouth. So it has to do it has more to do with your absorption, how your medication is being absorbed. So orally it gets absorbed inside your system. There's parts of your body where the absorption takes place. Unfortunately, with IM, if it has to be intramuscular, it has to be absorbed inside your muscles, not on your inside your mouth.
Now I'm thinking about drug users or people that inject drugs, and they use different types of their bodies or different parts of their bodies to inject drugs, such as their arms. I think those ones are more into veins, right? I think they're targeting veins. Or okay, now it makes sense. See, now I'm being educated on my own feature. This is great. Listen, ladies and gentlemen, and in Disego's words, and everybody in between. We have come to an end, and that was Mpho Mankayi giving us the 411, answering some of the questions that you have when it comes to STIs prep and ED prep. And if you have more questions, please send them through to us on our website, www.popn.org, or leave them right here on the comment section below. Mpho, thank you so much for your time. I really appreciate it. I hope to have more of these engagements soon. Well, soon, I think next week. I think you'll be here again next week.
Definitely. I'm looking forward to with you guys. I've become a regular here, so it's fine. I'm no longer a stranger. Thank you so much for having me.
No, you're not. Have a great Monday, Mpho. That is Mpho Mankayi from Orampop in eThekwini giving us the 411. If you have any questions, like I said, make sure that you drop them on the question section below. But nonetheless, I've learned a few things about the injectables. Me, I thought clinicians, they just like touching our laptops. Kantika, there's a reason.
There is a reason. There is a reason.
Yeah. But I've learned. Listen, I've thoroughly enjoyed this. I'm going to see you again next week. But this coming Friday, actually, not even this coming Friday, for It's a Wrap, we are starting officially to do It's a Wrap on February, or rather in February. We're going to be bringing you some of your faves when it comes to the LGBTQI side of things. Make sure that you are part of that, but nonetheless, continue supporting, continue liking, continue following us on all our social media platforms. Until next, also the Mapaseka, we apologize that you couldn't be here, but I know that you were looking. She was definitely looking forward to this one. But we're definitely having her next week. Hopefully, she'll be settled by then, and network will be on her side. But until next week, Monday, for yet another Clinical Monday, it's been real. Happy streaming. Bye.
Cheers.
WhatsApp,